Good day. My name is Michelle Levander. I'm the director of the USC Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, Will RFK Jr. Make America Healthy Again? 2 weeks ago, Robert F. Kennedy Jr. was confirmed as Secretary of the U.S. Department of Health and Human Services. The vote capped a remarkable storyline in which a controversial figure, best known for his vaccine skepticism and fringe views on a host of public health issues, is now leading the nation's top health agency. Public health officials were already concerned about how RFK Jr. might use his new powers to undermine childhood vaccinations. Yesterday, he seemed unworried by what public health officials see as a three-alarm fire: the death of an unvaccinated child from measles in Texas. Kennedy said that the measles outbreak that caused the first death since 2015 was, quote, not unusual in a cabinet meeting. And it's not just on vaccines that Kennedy will likely make his mark. He has many ambitious plans as he seeks to make America healthy again. He argues that the federal government spends too much on infectious diseases at the expense of what he calls an epidemic of chronic disease. He plans to redirect spending. He wants to go after America's love affair with processed foods and sugary drinks. And as a leader of the new Make America Healthy Again Commission, he wants to investigate pesticides, antidepressants, vaccines, and even cell phones and microwaves. RFK Jr. is ushering in a new era for the nation's health. His planned actions could face legal and political challenges and imperil public health policies that have fought infectious diseases for decades, as we'll discuss in today's webinar. We'll be hearing from two journalists doing important reporting on RFK Jr. and his policy priorities. We'll also hear from a leading legal expert on some of the legal challenges that could blunt his efforts. And we'll share ideas on how reporters can find ways into these stories at the local and regional level. We're joined by three distinguished speakers. Isabella Cueto is a chronic disease reporter at STAT. She joined in 2021 as the inaugural Sharon Begley STAT Science Reporting Fellow. Before that, she covered local issues in California, South Carolina, and South Florida. Her work has been recognized by the National Association of Science Writers, the South Carolina Press Association, and the Society of Professional Journalists. Dan Gorenstein is the founder and executive editor of Trade-Offs, a podcast that explores tough choices in healthcare, diving into issues like the cost of care, health equity, insurance, mental health, and artificial intelligence. Before Trade-Offs, he was the senior healthcare reporter at Marketplace and spent 11 years at New Hampshire Public Radio. He got his start in journalism at the Chicago Reporter, an investigative journal that examines race and class disparities in the Chicago area. His work has earned numerous national awards, including the Society of Professional Journalists Sigma Delta Chi Investigative Reporting Award. We'll also hear from James Hodge, a national expert on health law, ethics, and human rights. He's the Peter Kiewit Foundation Professor of Law at the Sandra Day O'Connor College of Law and Director of the Center for Public Health Law and Policy at Arizona State University. From 2010 to 2023, he served as the founding director of the Western Region Office of the Network for Public Health Law, funded by the Robert Wood Johnson Foundation. With others, he drafted several influential public health laws, including the Model State Public Health Information Privacy Act and the Model State Indoor Air Quality Act. Before joining the College of Law, he was a professor at the Johns Hopkins Bloomberg School of Public Health and an adjunct professor of law at Georgetown University and a faculty member at the Johns Hopkins Berman Institute of Bioethics. This webinar is made possible thanks to the generous support of the California Endowment. We will be archiving this conversation later today at centerforhealthjournalism.org. A word about our format. We'll be hearing from our speakers first, and then we'll turn it over to all of you for questions. Feel free to share general comments and questions in the Q&A panel. You can write us there if you're experiencing technical problems as well. And now let's get underway. So Isabella, let's start with you and ask you to kind of give us a landscape view. Public health experts think RFK Jr. could influence policies on everything from food labeling to infectious disease preparedness, and of course, vaccines. What are some of the most likely scenarios based on what we know about his priorities, and how could he impact agencies and institutions even beyond those he directly oversees?
Thanks for the question, Michelle, and thanks everybody for being here today. Well, I think first and foremost, based on RFK Jr.'s many years criticizing safety studies and safety data on vaccines, we can assume that he will go in that direction, though we don't know exactly what he'll do. It's been reported that he could replace key members of vaccine advisory panels, and that could probably change the shots that are available or free for people to get. And he and some of his allies have also outlined some of the ways that they could reform vaccine science in the Department of Health and Human Services. But he's also cast doubt on a lot of things throughout his, the past few decades. He's cast doubt on antidepressants and ADHD medication. You mentioned cell phones in the beginning. There are a lot of like claims that he has made, and he now has room through the Presidential Maha Commission to try and investigate some of those and bring more awareness to them. He's also spoken a ton about the food supply, about slashing the list of food additives and banning certain chemicals and cracking down on ultra-processed foods, which you also mentioned, Michelle. And so we can expect him, along with the FDA commissioner, to work on those issues. He also has an ally at USDA in the head of that agency, and they could expand his reach further into agriculture and farming and those types of things. So I think we can expect a pretty broad reach from him, in addition to the kind of social and cultural influence that he has, which we've already seen has awakened this appetite for non-traditional medicine, for doing your own research, for supplements, and kind of going against the existing medical and scientific establishment. And so I expect that to continue and keep permeating the culture.
Thank you. Thank you very much. Dan, let's turn to you. As Isabella alluded to, Secretary Kennedy will have some impressive powers when it comes to vaccines, and that's through a little-known committee called the Advisory Committee on Immunization Practices. What changes do you anticipate he might make to the committee, and why do public health experts fear that fewer people would get vaccinated?
I'm muted. Sorry. Just thanking everybody for being here. And it's pretty great, Michelle, that you guys want to convene this kind of meeting. This is clearly, there are a lot of people on this call right now, and there are a lot of people on this call because I think people around the country understand that what we are talking about is, and I know this is a little bit of a cliche, but unprecedented times. We're talking about something really significant here. As it pertains to your question, there is this it's the most powerful committee that no one's ever heard of. It's called the Advisory Committee on Immunization Practices. And the Secretary Kennedy, is authorized to remove or add members at will. Just a contextual point before I get into more mechanics. Kennedy has said in interviews that he does not want to take away vaccines, but he has said people should have a choice and would make information available to make that decision. And sort of what does that mean? What does that look like? No one really knows. So we're in the land of speculation here. But one way he could kind of deliver on this promise of not taking vaccines away, but giving people more choice, is he could name people to this committee who favor more relaxed guidance. The ACIP recommendations, which is made up of clinicians and scientists, they can make recommendations in two broad categories: vaccines that you should get and vaccines you might want to get. And we know that few vaccines carry that softer recommendation of the ones that you want to get, but research shows that that softer recommendation is more time consuming and confusing for physicians to follow. We know that when a Pfizer vaccine got that softer recommendation, the company ended up saying that the uptake of their vaccine went down. So this is just one concrete example of how Kennedy really could. A lot of people, folks like James, see this as one of the most powerful levers for how the secretary could exert control over his vaccine agenda.
I want to turn to all of you and ask you a follow-up question both of you have alluded to this idea of the power he has just by virtue of his bully pulpit as health secretary. And how do you all see that influencing how ordinary people make decisions about health for their family? What kinds of signals was he sending yesterday about vaccines, for example, with his comment about the measles outbreak in Texas being not unusual?
I can jump in here. I mean, I think he has built up incredible influence over the past decade or so. That is only more intense now that he has the formal title of health secretary. The remarks yesterday downplayed the death of a child from measles, which hasn't happened in the US in the last 10 years. And so it is definitely a break from convention, to say the least. Typically, health secretaries are, more of a figurehead, not really a personality in and of themselves. And he's definitely bringing his own flavor to the role. I think it was really remarkable in his confirmation hearings when he was pressed about vaccines and the link to autism. He really did not walk back his previous statements about that, even though scientists have shown time and time again that that link is not backed by science.
Yeah, and James, did you want to weigh in on this?
Yeah, well, let's be very clear. When you have the lead of the Secretary of the Health and Human Services, fully recognizing at the beginning of his tenure that we have a absolutely preventable death due to measles in the United States, in West Texas, and does not condemn that specific situation as something other than a gross failure of public health to actually assure vaccine-related populations are going to prevent that death, we're off to a bad start. This is not the sort of tone or tenor I would want to hear from an HHS secretary out to protect the public's health with every available opportunity for the use of safe and effective vaccines. That's what's breaking down already in some communities across the United States. That's what we're going to continue to face, or deaths just like this, absent real information about the utility and safety of vaccines going forward.
Yeah, and Jen, did you want to add anything on this question?
Thanks. I mean, I sort of feel like Isabella and James tackled it quite well. I can't stop being a journalist. I apologize. Isabella, I kind of have a question for you. Like you wrote this, like you had this great paragraph in a recent story that you said, and I'm just going to quote it. If Kennedy throws himself into other issues other than vaccines or even embraces mainstream science, Maha could whitewash his legacy of sowing doubt in public health. Some in Congress believe he might be especially well positioned to earn back the public's trust in health agencies, a doubter turned believer. To get there, he'll need a plan. I'm really curious. Like when I read that, my eyebrows sort of went up. Like, oh wow, are you like getting reporting that Kennedy may actually make that shift? And so that's one question. And then the second question is, given what he said yesterday, does that like maybe throw some cold water on this sort of doubter turned believer phrase that you wrote?
Yeah, I mean, I think I was writing that on the heels of the confirmation hearings, which both days were kind of in contrast with each other. The first day he was pressed and he kind of did try to walk back previous statements or say, oh, I wasn't advocating for that. This is just what I had heard or read. The second day he kind of drew a line of where his beliefs actually were. And so it did raise the question for me and folks I was talking to of like, which direction is he going to go in? And is he going to, for example, just follow Trump's lead on and take Trump's opinion of certain health related matters like abortion or mifepristone, which are things that have come up. And TBD, honestly, I think he could face intense enough pressure on key issues that he will kind of, bow to that. But it seems like vaccines, I mean, he's been working on the vaccine issue and pushing, misinformation or alternate ideas about vaccines for years, and that's just not going to stop just because he has a new job.
And James, let's turn back to you, and thank you, Isabella, for these perspectives. What do you see as some of the legal tripping points that could potentially thwart or stop him in his pursuit of potential anti-vaccination plans or proposals? And also, given the new administration's proclivity to push through things and then correct later if there's a legal challenge, would such legal obstacles have the same impact in this administration?
Yeah, it's a heady question for sure, Michelle, on both fronts, but let's start with a very clear sense of exactly what sort of levers that the secretary has available to him in that new position. They're manifold. I mean, he's got a lot of opportunity with influence, with power over the purse, with the ability to set committees, with the ability to slow down processes at FDA and CDC and to determine who actually is going to run those particular subsidiaries of HHS. There's a lot of sense across the nation that we're about to have, the biggest challenges we've ever seen in regards to vaccination policies and procedures and all those things going forward. And I'll be the first to tell you, yeah, these challenges are profound. But you're up against 150 years of pro-vaccine laws at the federal, state, tribal, local, and even military level. That's what we've got in our backseat. We've got 150 years of laws not out to stop us from accessing vaccines, but to promote those vaccines. Because of what CDC and so many others have recognized over decades, it is the #1 public health achievement by far in regards to saving morbidity and mortality in the United States. Those vaccine laws are very much entrenched, very much in place, and they stand as a nice buttress against a lot of what you just heard. But also with that is another observation, and that is the Supreme Court of the United States is in our corner pocket as well. Rarely has it issued an anti-vaccine related opinion in regards to anything other than the potential for it to install a set religious exemption. It's still not done it yet to all vaccine mandates. It could, and it's toyed with that idea before. But basically, the U.S. Supreme Court in our back corner has basically said so many different ways vaccines are lawful, they're legitimate, they do not present a liberty infringement when effectively implemented. And then one other obstacle here, if it's a big one, the one thing the feds don't control, even though they have a lot of resources and a lot of power and influence, they don't control state laws at the licensure level. They don't dictate how doctors, nurses, pediatricians, and others are going to actually implement vaccine-related measures and efforts. Talk to pediatricians about what they're prepared to do against the backdrop of anti-vaccination recommendations or removing known efficacious vaccines from the existing ACIP list or otherwise. And they'll largely tell you, we're going to be influencing and heavily dictating to parents and others, continue to vaccinate your children at the same rate and same scale that we've seen before. That's why across the United States, we do have actually fairly good high 90% plus vaccination rates among kids. It's the breakdowns in West Texas, New Mexico, and others that obviously are getting the headlines right now.
Yeah, okay. And Isabella, just kind of to pivot a little bit away from vaccines, RFK Jr. has said that President Trump asked him to end the chronic disease epidemic. That's a tall order. And what will you be keeping an eye on to see if he follows through on that promise?
To me, this is the most important question. I mean, there's the politics and everything else, but we know that the state of chronic disease is really bad in this country. A lot of people are suffering, and so it's not acceptable to just throw that out and say you're going to do it and then not follow through. So I, along with many other reporters, I'm sure many reporters on this call, want to follow exactly what he's doing. And we already know quite a bit about disease prevention and the main things that are killing us in this country, just heart disease, cancer, strokes, accidents. In kids, we're talking about high rates of asthma and diabetes, obesity. Many of these ultimately have to do with poverty, with healthcare access, with health disparities, even though disparities are kind of being systematically wiped out of federal agencies and the related literature. You simply can't ignore those when you're talking about chronic disease, when you're talking about the life expectancy gap between Black people and white people in the same city. And so I'm going to be watching what are the actual policies that they are enacting, and what are the policies that the administration at large is enacting, and how do they square with that goal of ending chronic disease? Cutting Medicaid, people I've spoken to who study these issues, they say that is counter to what the goal is of MAHA, of reducing chronic disease. Cutting off access to vaccines, either by making them expensive or taking other actions, that's not likely to improve the rate of chronic disease. Research funding, things like that. And so I think for local reporters especially, it's really important to get a picture of the state of things now where you are, what are the leading causes of death and disability and major illnesses in your areas. And there's data available for this by zip code, by county, by state. You should try to make inroads in your local and state health departments and the people that really care and are trying to fix this, and talk to people who are sick and figure out like what is making them sick. What are the things that would help them get healthier? Is that simply just having more income that they can spend on something like a gym membership? Is that having health insurance? Is that having a primary care doctor? And all of the people in the community that are on the ground trying to fix this will know firsthand, hey, here's what we've tried. Here are the programs that worked a little bit, but not in this way. Nonprofits, foundations, like primary care doctors, even personal trainers, are working with people who are trying to get healthier. And so there's kind of unlimited sources that you can tap into to understand that. So that's what I'm trying to do on a more national level, is just get the baseline and then closely follow actions and not just words.
Thank you, Isabella. That's a really great roadmap. And one of the things that we know can contribute to the nation's chronic disease burden is our abundance of processed food and sugary drinks. And Secretary Kennedy is not the first person to try to wean us of all this. They've been linked to the nation's rising rates of diabetes and obesity. And there's an estimated 15 million American kids considered overweight or obese as of 2021. But historically, the food industry has successfully blocked policies like a soda tax. So Dan, do you think there's a reason to think that RFK Jr. will have more success in winning this battle against these really powerful interests than those who've come before him?
Right. I mean, I think that's the question. What makes Kennedy different than all these other HHS secretaries that have identified chronic conditions as something that's super important that they really want to tackle? And about a decade ago, there was all this enthusiasm for the soda tax, and the soda tax was making, and in isolated communities, it still has. In Berkeley, California, it has been very popular. It's been very successful. It's raised money for local schools. It's led to the decrease in obesity rates. It's improved health of Black mothers. Like there's some really good things here, but we saw the American Beverage Association come in and help really lobby hard and sort of shut that action down in California. Laws were passed in a handful of other states, Michigan, Arizona, Washington State, maybe one other. So Kennedy, kind of like Isabella's talking about, Kennedy had, like, he's talking a big game. What can he really do? And I think just to be sort of specific about some of the levers he has when it comes to regulating food policy, I just got a couple of notes here that I'll run through. The nation has dietary guidelines that get updated every 5 years. The next update of those guidelines is expected later this year, and these guidelines are effectively a roadmap for policy. The FDA also has the authority to turn these guidelines into requirements for the food industry. And the most obvious way that happens is when the FDA uses the guidelines to inform nutrition labels that we see on the packages. There's a proposed rule that would put key nutrition information on the front of food packages. So we know, labels matter. There's been big fights over labels. So what's on our labels is something that Kennedy could do. This is something that Isabella has talked about in some of her reporting, but even if they do move forward on some of these labels, don't expect that to happen overnight. There are likely to be, there's a big, long, extended rules process. There are potential court battles. Like this could be years and years in the making. But if Kennedy is really serious about this stuff, there are ways that he can begin to make inroads. When it comes to like what makes Kennedy different as an HHS secretary, we got this one quote that I really loved, and it's from this woman, Susan Main. She ran the FDA's Food Safety Center under Obama, Trump 1, and Biden. And she said that more congressional pushback on regulating food came from Republican members of Congress than Democratic members of Congress. And she said, quote, when we asked her about this, we have a really unique opportunity to get bipartisan support for a healthier food supply, which is not what I experienced during previous administrations. So that's an opportunity. But what it means is that the administration, would really have to prioritize health and nutrition over deregulation. That's a really important thing. So which is going to win that battle in this administration is really an important question. And I want to swear, I'm not going to swear, but I want to swear, I love that quote. It just so encaptures, like, what are we really talking about? I think Kennedy comes more from the left in certain ways. And some of the things he's talking about, particularly when it comes to regulating food, is more of the left. Is the administration going to be responsive and open to that? Or are they going to really kind of shut that down? Is Kennedy going to be able to leverage the political will of a popular Republican president and a Republican Congress to actually get something done that many Democrats would struggle to do?
Yeah, thank you, Dan. And as I recall from past battles here in California, the American Beverage Association and some of their sister organizations were really effective at, for example, seeding funding for what are known as AstroTurf groups, which are really fake grassroots organizations that talked about, individual liberties and taxes and things like that, and were really able to shut down some measures that would have implemented all this. I don't know if you or James, if you want to weigh in on this, anticipate something similar playing out if this were to go, if Kennedy's vision were to go forward.
Yeah, I mean, I would love to see some of what might occur if Dan's right and the secretary is willing to take on, big food and all the issues related to the unhealthy amounts of consumables Americans take in. Great, let's do it. This is exactly where we could see alignment at the federal, state, and local levels about, a unique and potentially opportunistic moment to shape and improve upon Americans' diet and really make great advancements there. It's just one problem. Will the Supreme Court go along with it? Will the Supreme Court now then issue, as it's threatening to do, new standards that would actually sort of inhibit or stop HHS and every other federal agency in its tracks from issuing regulations without explicit authorization from Congress? That's what you're seeing already before SCOTUS, is this idea that we may actually see a reinstitution of the non-delegation doctrine, where you just flat out got to have express, direct authority from Congress to make some of the regulations that could be innovative, could be helpful, but may not be purposefully allowed via Congress. Getting all forces aligned on this is going to be very interesting over the next 3 to 4 years to come.
And James, not just on this, junk food category, but just more broadly, and not just on an agency federal level, but also on a state or a local level, what kinds of abilities will local and state jurisdictions have to try to assure the public's health, when there might be, a different vision coming from RFK Jr.?
Yeah, great question, Michelle, because states, localities, tribal governments, they're feeling it already. They are forecasting and seeing what's coming down the specific, sort of direction from HHS and all of its subsidiary agencies, and of course, across all of the presidential authorities that have been put basically on trial since President Trump stepped back into office. A lot of them are very concerned, and for good reason. To the degree to which this administration, however, does want, as Dan was suggesting, Isabella's pointed out, if they want to advance public health initiatives, state and locals are actually willing to work with them too, even across, bipartisan sort of ways. State and local governments are not out to defeat some of these objectives. It's the opportunity cost of doing so. When you actually put infectious diseases as a second-rate concern over chronic conditions, fine, you go there, because chronic conditions are what kill most Americans in the United States, as we know. But you don't sacrifice infectious disease control and efforts along the way, because they will kill young children in Texas as a result. Here's what we're starting to see states fighting back in relation to it. First of all, it's game on in some of these jurisdictions. They literally are, through their attorney generals and or governors, taking on the federal administration already. Multiple really strong, well done, well-placed lawsuits in real time are currently underway in federal district courts, challenging a lot of what you're seeing, and will continue to be challenging it through Democratic AGs and others. Those actually applaud just as an initial effort to actually demonstrate what and how far we may go judicially to counter these specific initiatives. It won't be enough. We're already aware of some of what President Trump and some of the officers have indicated is their allegiance to and or need to literally adhere to court-related judgments. It won't be enough. So states better get savvy, and they are, about what else they have available. And that is the power of negotiation. You see, states have things in the public health arena that the feds want and need. And whether states actually get to that point of recognizing that we have these abilities to put these chips on the table, like access to the frontline responders that states control, access to all the resources and the sort of general welfare police powers as we know them that states can utilize to effectuate federal and state public health objectives, all the data that states collect that feds only get because states do that. Are these chips on the table for states to negotiate with the federal authorities at CDC, HHS, and otherwise? You bet they are, and it increasingly may be something legally that we start to see enacted. And then let's remember one last final theme here, and that is states are sovereign governments, as are tribal authorities. They're sovereign governments. They have actually more direct authorities over populations than the feds do. They possess the larger police powers of the United States. They will be utilizing these effectively, and at times, against the backdrop of that sort of federalism concern we hear about constitutionally, states will exercise those authorities. They will win on those judicially, and we shall see some of that battle play out when really necessary, like Michelle in the backdrop of children dying from measles in West Texas.
And Michelle, if I could just jump in for a quick second here in terms of being specific about why states are in some ways really beholden to the federal government. We had in one of the stories that we worked on, going back to this committee, ACIP, they run this program called Vaccines for Children program. Federal funding is guaranteed. About half the nation's children are eligible for vaccines under it, which in 2023 represented $5.2 billion in spending. We talked to the state of Hawaii about this. They're getting, I forget what the number is, but it's in the tens of millions of dollars. And if that money goes away, what are they going to do? The most vulnerable children in Hawaii are relying on these vaccines, and their families are relying on these vaccines. And something that really struck me that I guess I'd like to share with the group today is that this program, the Vaccines for Children program, was born out of a deadly measles outbreak more than 30 years ago. And, this sent thousands of children to hospitals. It killed 123 people. Again, measles, we're talking about measles yesterday in Texas. This is measles. And what happened is that some children became ill. They saw doctors, but were unvaccinated because their families couldn't afford the shots. The doctors referred patients to free clinics, but that extra step was a real barrier to pick up. And as a fix, Congress set up this program to pay for these immunizations. And what we're talking about here when we're talking about vaccines in some ways is if we undermine this, is we're undermining this hard-won public health lesson, which is that research has shown that policies that make vaccines low cost or free help push up public protection against disease to levels that largely prevent outbreaks. So it's always interesting to me when this is a moment where there is history, there are lessons learned, there is data and evidence, and some of the policy choices and decisions that this new administration may be making may be flying in the face of these things that we have already learned.
Yeah, and I'd
Thank you.
just add a quick thought. States aren't going to stand for that. They're not going to stand for it. They have ways to fight it, and they're already underway in that respect.
And I want to go back to this idea of the states and the potential for either lawsuits or negotiation. And Isabella, just ask you, for journalists who are covering this, not as you are on a national level, but on a state or a local level, what are some of the things that you would recommend they start preparing for, and who might they want to line up in their contact list and that sort of thing?
Yeah, I mean, I think in addition to the sources I just mentioned a moment ago, I'll emphasize again, public health departments, staffers, like people working in healthcare on the ground, like they have been through the ringer the past 5 years, and they don't want to deal with more difficulty. And so if you can presented as like, I'm helping you communicate key information to the public. I want to be as accurate as possible. Like, you're likely to find some sources there. I think there's also going to be elected officials who are co-opting the language of Make America Healthy Again and some of RFK Jr.'s ideas. We're already seeing that in places that are lawmakers are introducing bills having to do with school meals or having to do with food additives, things like that. And so, MAHA is to some degree a grassroots movement of kind of post-COVID people being afraid of getting sick, of their family getting sick, and responding to that by, bucking traditional ways of doing things in science and medicine. And so we're likely to see that. Will your state or local officials try to repeal certain vaccine requirements or expand religious exemptions or alter the guidance from local and state health departments? Will they try to roll back water fluoridation? We're seeing that in some places, or passing bills like the ones I just mentioned. Are they taking a different approach and actually trying to invest in these community efforts, community health workers, or food as medicine, meals on wheels, things like that, that try to get more at the root causes of chronic disease? I think there's like a million ways that states and locals will spin off based on MAHA. And so I would just start having those conversations with, your city council leaders, county council people about how they're thinking about it and how they might take a local approach, in addition to all the fears about funding cuts, staffing cuts, et cetera.
And Dan, what would be your advice also on this question about sources and storylines as folks try to anticipate just such a fast-moving administration? You're muted, Dan, you're muted.
Sorry, thanks. Hold on to something firm and try to find some good work-life balance. That's like something I've been trying to do. It can be hard. But in terms of more specific concrete resources, I asked our reporter producer, Melanie Evans, what she does. She did a lot of the lion's share of the reporting for our work on Kennedy. And she said for good primers on federal policies, you can check the Congressional Research Service. For example, they've got a 2-page overview of this committee we've been talking about, ACIP, and that's a great place to kind of get your feet wet in understanding the federal lay of the land. Some of the best sources I ever had are researchers, academics. So searching Google Scholar, the National Library of Medicine for researchers. These researchers often might know people locally who could speak. And they also could just be good expert voices to round out the story that you're working on. Professional associations, the National Association of Medicaid Directors, or the Association of Immunization Managers. Those are folks who are tracking these health things. Local chapters of national medical societies, the Infectious Disease Society. Who are the people in your state that really care about public health? Find one of those people and then ask them who they know. And I'm sorry for the antiquated term, who's in their Rolodex. Like, that's what you kind of really want to do. You pull that thread and just watch it go. And as James and Isabella have pointed out time and time again, public health, as the name would suggest, really does touch almost everybody. So you will find lots of people being interested and having a vested interest in public health, including, by the way, these folks sometimes are obscured, employers, particularly the largest employers in your community. They really care about public health, because if their workers can't show up.
Yeah. And Isabel, I want to turn to you, and I want to mention to everybody in the audience that we're going to be opening this up to your questions shortly. We have a bunch of questions in the Q&A panel, but please feel free to add yours, and we'll try to get to as many as we can. But Isabella and Dan and James, please chime in too. But Isabel, you were just talking about how different jurisdictions are already doing very different things, on different sides of the political and ideological equation. And I'm just wondering, for things that have required waivers to do something creative involving Medicaid, for example, California has this very ambitious multi-billion-dollar effort called CalAIM, and it tries to systematize something that you alluded to, which is this idea of expanding what we consider healthcare and what could be covered to include things like helping somebody who's leaving prison or jail to get signed up for Medicaid, or providing services to people who are unhoused, that might, or even just something like if an elderly person is frail and at risk of a fall, literally fixing the staircase on the front porch of their house that could cost, I don't know, $500 versus, the thousands of dollars and lost, quality of life of a fall. Are those kind of things, do you think, still going to be tootling along, or could they be endangered by just a very different vision and maybe revoking a waiver?
I wish I knew the answer to that question. I think that's 100% something that reporters should be looking at in their states. I mean, health means a million different things, as you're pointing out. And one of my colleagues, Eric Boudman, just wrote a great story about how a woman I think in West Virginia, she would have someone drive her to dialysis 3 times a week, and now that man doesn't show up because he was, cut from the federal workforce. And so this is not like theoretical, like these are direct impacts on people's lives. And so figure out what's going on already, what are the projects that the state has tried, and if they're cut, like what the repercussions of those are. I don't know if Dan, you have more insight than I do on the future of those.
Yeah, I mean, I think one of the things, and probably lots of folks on the call know, that states really are the laboratories. So that's where so much innovation happens. I think there's no doubt that we're going to continue to see lots of innovation at the state level. There's a lot of talk about work requirements. Some people consider that, pretty bad stuff. Some people consider that amazing, incredible innovation. That's certainly going to go forward. I think you know, like you said, Isabella, it's a great question. I wish I had the answer. Thinking about MAHA, at its core, MAHA is got a lot of overlap with what's called social determinants of health, or SDOH. People might on the call be familiar with that acronym. This idea that healthcare really is about the life that you live. And I think MAHA is somewhat consistent with that. And so are you going to have a CMS that's really open to thinking about ways beyond traditional healthcare delivery reforms, insurance reforms, that are going to be ways to improve health? If we take Kennedy, I think, at his most generous around the MAHA movement, then I would say, yes, we'll continue to see action around SDOH efforts and initiatives. I mean, at the same time, there's some people in California, because of this CalAIM program that you're talking about, Michelle, some people, some low-income people, some marginalized people are getting their rents paid. That's the kind of thing that Republicans tend to pretty much abhor. What will they do around that? I feel like a lot has changed in the last decade when it comes to SDOH, and because of COVID, there's a lot more recognition that healthcare really is a lot bigger and broader than the hospital or the doctor's office. So if you force me to pick, I would say, because it's Kennedy, we're more likely to see SDOH work continue than be shut down.
Yeah, I'm kind of with Dan on that too. I mean, listen, the sort of ways in which states have been innovating on health and all policies and health impact assessments and medical legal partnerships and programs, I don't think the federal government's going to stop that. It may not fund it, it may not make the resources available, but some of these don't take much more than pennies on the dollar compared to other interventions to have really great effects. And to that end, if states are innovative on those fronts with very few legal inhibitions that actually stop those initiatives, go for it, because that's maybe where we actually get some improvement in health outcomes, even against the backdrop of some truly deleterious themes arising at the federal level.
Yeah, thank you, James. And we're going to turn over to questions from our audience. And so let me just pull up one of these. There's a lot. Let's see. Well, yeah, I mean, this is a question from Julie Cantor Weinberg, who says, do you think that we will be able to get COVID and flu shots next fall? Also, will there be any focus on helping people with autism rather than just the false link between vaccines and autism?
I can address the COVID and flu vaccine question. I'll be deferential to our additional panelists and otherwise. Yeah, you're going to get them. The question is, will they cost you out of pocket? Will we continue to keep vaccine access part of the essential health benefits that the Affordable Care Act has made possible? Will Medicaid programs continue to provide these, or will we have lost, tens of millions of persons off of Medicaid by then? You're not going to, I don't think under this federal administration, see those vaccines cut off to you. Big Pharma's got interest in making sure you get access, but you're going to have to pay for them. And that, for many Americans, is a cutoff, as Isabella was saying. So watch out for that. And as to the other part of the theme, I'm deferential on with our other panelists.
On the autism question, I mean, there is ongoing research on autism, trying to find like what is the mix of factors that drives it. It's obviously there's many different kinds of autism and experiences of autism, and so there is a lot of research still needed to understand that spectrum. Whether they will keep doing that and keep funding it is a good question. But I can't foresee like essential services in someone's community being cut off, like for a child that has autism. And maybe James or Dan, you know better than I do. That's my first instinct.
I mean, I've not done any reporting on this, so I want to kind of say that up front. I think the logic is that clearly Kennedy's group, the Children's Defense Fund, whatever that's called, they care a lot apparently about autism, and that may in fact be a signal that they'll continue to be really interested in this. But I do think this question of like, we know Congress is contemplating budget cuts to Medicaid. I mean, what sorts of services? There are lots of families who've got children with special needs, and if there are certain types of cuts to Medicaid, some of those services go away. And what impact would that have? And so, like, that's, I think, for people who are interested in this question, monitoring what is going on in Congress and what sorts of social service cuts Congress would pass is sort of critical.
Yeah, Dan, I agree completely. Listen, the types of ways in which Medicaid cuts will impact children with special needs and their families are front and center. I mean, we have folks literally on Capitol Hill now lobbying Congress to make them aware of these particular repercussions. It's a bipartisan issue too, and I think it's one of those that children with special needs may come out of this well in regards to at least being heard, and those constituents noting what these impacts could be if you really start hitting these special programs, Medicaid, Children's Health Insurance Program, vaccines for children. These are not good outcomes related to it for the health of the population, but particularly for kids, which all of us from a bipartisan perspective are out to protect.
And I will just add, this is a little bit of a random fact, but pulling the curtain back on being a reporter, back in the Great Recession, I worked at New Hampshire Public Radio, and I covered the budget at a time when New Hampshire lawmakers were making very difficult decisions to cut the budget, and they decided to go ahead and cut social services to families with special needs. In the 11 and a half years I worked at New Hampshire Public Radio, I've never seen larger hearings. I've never seen more of an outcry from people. And if we are talking about a future where these special needs, just as you say, are alluding to, James, if these programs and these services get cut, there will be a lot of focus and a lot of attention. And I will just add, finally, is some of the most emotional stuff I've ever covered in my entire professional 20+ year career. There were very rarely was there a dry eye in those committee rooms when those services were being cut, because you're talking about people who really have almost no other recourse.
And, you know, I think we're starting to see the stories emerge now internationally about USAID and those pretty draconian and sudden cuts and the ways that that is having, you know, very real life consequences. But one of the things that's being said is you can't sort of put the pieces back together and again after you've just, you know, killed a program. So I don't know if this idea of, you know, the hearings and so on, um, you know, what is this the moment for a certain kind of coverage on Medicaid and what it's really doing, and what are the kinds of stories that you think might be worthwhile to share, for, especially for local and state reporters?
Well, I would offer one up for sure, Michelle, and that is, how do you justify this U.S. Supreme Court if you're going to allow this administration to continue on short notice to just, you know, fail to provide these basic essential services, USAID? That's just rather indefensible, at least under what we're seeing already through that court. So we've got some major judicial challenges ahead. A lot of people are concerned about what the Trump administration won't adhere to in regards to judicial courts. What will those courts actually be doing ahead? That's going to be a storyline for 2025, unfortunately, in a very big way.
Yeah, thank you, James. And I don't know, Dan and Isabella, if you were operating on a local level. I mean, just to kind of give an example that we just heard from in our Q&A, a woman named Joan Ogden writes, why haven't the various members of the media reached out to those of us who had diseases like polio and measles before vaccinations were available to highlight what we've been dealing with? I, for example, spent time in an iron lung with bulbar polio, and maybe hearing my story might change some parents' perspectives. And so I don't know, just wanted to, it's more of a comment than a question, but does sort of raise this question of what kinds of stories journalists might think about telling.
Well, I can't speak for the media.
Why
But
not?
there are a lot of different outlets, and I know that we have published some opinion pieces from polio survivors or people who have been directly affected by things like this, and I think those stories are really powerful. It's really like my eyes widened when you said iron lung, because that's obviously not really used anymore, and so it's like just amazing that you have that knowledge and you could share it with others. Yeah, we love direct stories. I think getting that ties back to your question, Michelle, of like actually putting a face on it. And a lot of people don't really hear Medicaid or Medicare and their eyes glaze over. And so being able to tell your readers, like, these are the exact services that would be, you know, imperiled by potential cuts. These are the exact people in your community. This is the block where the most, you know, Medicaid beneficiaries live. Like things like that really have an impact in a way that just writing about the possibility of a funding cut does not. So I would look for those opportunities.
I'd really echo what Isabella said there. I think that's so spot on. And like, you know, most people don't know what Medicare is or Medicaid. And so if Medicaid, if Congress is contemplating cuts to Medicaid, I think a good local story is like who in our community is on Medicaid? What does Medicaid actually do? And why is it useful? Is it not useful? What's the debate around Medicaid? Like, is there any, from a local perspective, is anyone like pissed off about Medicaid because they think it sucks, or is like it's wasting money, or are people pretty psyched about their coverage? Like, what do we know about Medicaid at the local level? I think really trying to like humanize healthcare journalism, as we all know, is so difficult because it's so complicated, so wonky, and yet it is ubiquitous. It touches literally every single person. And the trick, at least for us at Trade-Offs, has always been, how do you like bring some data, bring some facts, but also bring that human face? And I think the person with the question who was in the iron lung had a great suggestion. Put your, you know, one way that people can get these stories out is by reaching out to their local reporters. If you have a story, if you got a story about being in an iron lung, if you got a story about being on Medicaid, share those, reach out to reporters.
Mhm.
And I think it's really important that people feel, both reporters and the public feel empowered to talk about what is being discussed and contemplated, not necessarily with a political agenda in mind, but like, look, these are serious policy decisions and there are very real economic and human cost ramifications. What are they? Let's discuss them.
Yeah, good points. And listen, don't just talk to the people that experience these conditions, like it's probably happening in West Texas right now. Talk to the providers. During COVID, I thought talking to the doctors and nurses actually dealing with the tens of thousands of patients in their communities or whatever, pretty impactful. And in fact, even a brief exchange I had on the measles front with a doctor in Michigan who actually dealt with measles cases 30 years ago in an outbreak that occurred there. So impactful. She remembered all of the details, all the elements, and all of the things that doctors can tell you straight up. This is how this really damages not just the public's health, but those individual patients that they dealt with. Sometimes the doctors and nurses can be one of the best interviewers going.
Thank you. Thank you, all of you for these really great suggestions. This is a very big question that I'll just ask you to try and weigh in on succinctly because it could be more than one webinar, but that somebody asked, if there is a major bird flu outbreak similar to COVID-19, how do your panelists think Kennedy would respond to it? But I'll just say there's been some very interesting reporting by a journalist named, for example, Mary McKenna, talking about how the jump to cows from poultry is already problematic because the kind of the infrastructure for containing the spread of the disease in poultry is very well established, but that's not the case for other kinds of agriculture. So, some might argue there should be a response now before there's a major outbreak. So I don't know if this is too big to answer in a minute, but
No, I mean, it can be done, Michelle, for sure. I mean, listen, one of the things that we've been seeing with avian flu is this is one of those slow moving sort of potential pandemics that we're really watching carefully. States and others have been on top of this and watching it. The Biden administration watched it. President Trump has put into place a avian flu czar who's very qualified and to be sure, very capable. But this has got interjurisdictional, interagency issues all over it. USDA is doing its strong part, but it just had its workforce gutted, even on avian flu related fronts, some of which are reinstalled. CDC is involved, ASPR's involved. So many federal agencies have to coordinate and respond to this in real time. There's going to be gaps and issues along the way. However, paying close attention to it, because you don't want this to be that sort of sneaked up infectious disease risk that wasn't even an issue at the start of the administration, but becomes one like COVID did. I actually think this administration hopefully will get the pieces together and take good care to at least do what's possible through animal, plant, and human related sources to stop avian flu in its tracks.
Isabella and Dan, did you want to weigh in quickly on this massive topic? We have a question from Connie Diekman. I hope I'm pronouncing that name correctly. Well, two questions really that are kind of related around this arena of regulating ultra-processed foods. She notes that this country does not have a clear definition of what they are and who and how we reach agreement on that. And how do we share a nutrient-rich food choice message? And then she says, when RFK Jr. has no health background, and then she goes on to say, changes to labels, soda taxes, and other food industry actions are not just the industry standing in the way, it's also about society not wanting a tax and not wanting to pay more for the cost of labeling food and so on. So what do you see RFK Jr. needing to do in terms of consumer education with these kind of changes if they were to go through?
I'll take a stab at this. Remembering that I'm a journalist, right? I'm a reporter. I prefer asking the questions than answering them often. But I think that part of the education, I mean, as we talked about before with the vaccines, Kennedy has a bully pulpit that is pretty loud, and he has been using it for decades. He's quite skilled. He's sort of a bit of a darling of the media. People really pay attention to him. And I think that he has done more to get chronic conditions on the map of mainstream people than anyone has in the 15 years I've been a healthcare reporter. And so how do you try to like educate the public? I think part of it is you talk about the problems. The problems are pretty intense. There are a lot of people in our country who are pretty sick, a lot of children who are obese. This didn't used to be the case. There are ways to talk about and frame these problems that are pretty scary and disconcerting. And I think if anybody was well positioned to be able to talk about this and champion the challenges with the food that we eat and what is in the food that we eat and the role that industry has played, I mean, Kennedy could pull a page from Trump 1. It's rigged. What's in that bag of Cheetos is rigged. It's rigged to get you hooked, and you're gonna eat it again and again and again. I don't have it right now, but I'd happily pull out my Flamin' Hot Cheetos bag, man. I shouldn't be eating that stuff, but I love them. So that's one way. If we're talking about education, he could really just do a lot of infomercial type things that make it clear that America in many, many ways is very, very sick. And the costs that are associated with that are really hurting our country.
I'll add in here that making it a national priority and hot topic and getting people upset and outraged is maybe one of the more powerful things he could do, which I think is what you're gesturing at, Dan, too, is like food regulation has not really been top of mind, has been underfunded. Previous FDA leaders have said that they want to do more, they don't have the money to do it. And now if people care about it, if people are calling their representatives and saying like, why is there red food dye in my Twizzlers and not for European Twizzlers, then that is powerful. And so I think it's exactly that, giving people the talking points, giving people the exact issues to latch onto and become upset about, and bringing that awareness to it. As far as the question about giving advice on nutrition, I think we have pretty good science about like some of the basics of nutrition and like what is good for you, but definitely the universe of ultra processed foods is complicated, and it includes like baby formula and it includes junk food and a bunch of stuff in between. And so we need more research on that. That's also a question of funding. And I want to point out one thing, which I think is important, where we're talking about big food and the industry, but there is also a lot to be gained from these MAHA adjacent groups and companies that want to profit off of, either making like alternatives to the processed foods that RFK is talking about, or whatever else it might be, supplements that RFK is a fan of. And so we also need to pay close attention to those industries and the power that they're exerting on the new administration.
We have
There's a good story.
Yeah, no, that is a good story. And are they really healthy too? Our supplements, there's been testing to show that there's a lot of ingredients that were not supposed to be in there in mini supplements, for example. So how healthy are they? How healthy are they? We have a communications strategy question from Jordan Rees, who says, public health workers play chess with their messaging when the current administration plays checkers, and those simple messages are like catnip. What are the best ways to combat simple messages that have great uptake, like Medicaid is a fraud, and increased autism cases demonstrate a link to vaccines?
A concerted public health education effort really makes a difference in this regard, and one for which reaches to the same very channels that you might see that type of messaging that's inaccurate and misinformed reach. And to that end, the federal government has very deep pockets to pull off those sort of resources, but they're not off to a great start, are they? We just saw actually earlier this week a CDC campaign designed to illustrate just how effective a flu vaccine could be turning something that could be a wild repercussion for an American to a very mild one. Very good, very effective health education campaign shut down already by CDC under this administration. You got to have concerted efforts designed by professionals within the public health arena, tackling on misinformation, done systematically, percolating down in all those same channels. That can really make a difference. But you've got to be concerted in it, and you have to be dedicated. So far, we're not seeing that be the case for this current administration. But there's plenty of time, obviously, for new threats and new issues to arise for which these sorts of messaging could make a difference.
I think one of the points that this person is making is it's not just throwing resources and launching a campaign. It's that these kinds of messages, for example, Medicaid is a fraud. It's just so quick and so catchy, and so, or vaccines cause autism. So they're like earworms in music, something that lodges into your brain, and it's very hard to get the little song or the little jingle out of your mind, and that the public health folks have not been as adept at messaging about the science. And so I don't know, Dan or Isabella, if you have any thoughts on that.
I might just offer one additional 15-second thought before we hear from them.
Yeah.
I think that's a misstatement against public health people in the United States. I'm really going to state it straight up. These are very good. These people know how to communicate, and they know how to do it well. There are some missteps during COVID-19 we saw, but the reality is the innovations, the sort of, as Dan was talking about, the laboratory of what states and locals bring to the forefront, there's some really good communication tools out there. Paying for it, getting it out there in front of Americans and not being resistant on it politically, that's problematic. But the talent at the public health level to produce messaging that can counter that, it's strong.
Yeah, thank you, James. Dan or Isabella, did you want to add anything to that?
I can. I mean, I know Jordan quite well. It's a pretty tough question. If there were easy answers, we wouldn't ask that question. Science is complicated. Science is nuanced. And we did see, we did a lot of reporting and trade-offs during COVID about how public health people continue to try to figure out good messaging. And I think sometimes it's really hard to know how to make nuanced technical things simple. And that's part of the trick. It's trying to make it pretty clear and pretty easy. But there's always always an asterisk when we're dealing with stuff, because we could talk about well, you don't need to wear your mask, but there are some people, immunocompromised people, should be wearing their masks. And so do you put an asterisk down there, and underneath it, no mask needed, and then you have a whole long sentence about, well, if you're immunocompromised, it is very hard. I think the real answer is, in my mind as a journalist, is to try to flood the zone with good information. You make sure that you're reading Isabella's work. You're paying attention to what's being reported in your local paper. You're listening to the news. You're checking out a podcast like Trade-Offs. You're really kind of just, the more outlets that we have for journalism that are producing good quality information, the more likely it is for that to get across somebody's desk.
Isabella, did you want to weigh in?
No, I mean, I agree with what Dan said. It's a really good question and something I think about a lot. And I think, unfortunately, the short, quick, pithy comments, which President Trump is really good at, just stick in your mind. And it's really hard to then fill in the gaps and add more context. And so I don't have a good answer for that.
Yeah, thank you. And I want to just follow up on the point that Dan made about flooding the zone with information. Obviously, all the journalists who are on this webinar, the hundreds of people who are here, are committed to doing that. But I think we also have to think through some of the ways that we're sharing the beautifully crafted, well-sourced journalism that we're producing, knowing that people are increasingly getting their news accidentally because they're on TikTok and Instagram. And one of the things we're doing here at the Center for Health Journalism, for example, is working with journalists to kind of disassemble bits and pieces of their stories to entice people to get some essential points, or to lead them to read that or watch, or that whole story, by just going where people are and not expecting that we're still living in the world where everybody got the daily newspaper at their doorstep and religiously read it over their cup of coffee. I just think we have to also think about the ways that we reach people in a very different news, information, and misinformation ecosystem. I want to offer my thanks to Isabella, Dan, and James for just a fabulous conversation, and to the audience for all their great questions. I also want to thank the members of our team who helped make this possible behind the scenes: content editor Ryan White and communications strategist Apsmandar Bishu. We'll be emailing you a survey asking for your feedback on today's program and for your ideas on other topics of interest, and please take a moment to complete it. We also urge you to help support these webinars, and you can find more information here on how to do that. We'll be archiving this webinar a little later today at centerforhealthjournalism.org. Thanks so much for joining us, and have a wonderful day.
Thank you.